Diana Huddleston, the director at Aspire Indiana, joins me now. Hi, Diana.
Hi, nice to see you again.
Nice to see you again, though not under these circumstances. The last time we actually spoke, I went back and looked, it was April 4th. So we're 7 months into this pandemic now. How are things evolving for you guys? Mental health was an issue prior to the pandemic. I imagine has become even more of an issue now that we're this deep into the pandemic. And then we have the holidays coming on top of it. So break it down for us. What's it look like?
Right, thank you for asking. Just as we suspected, in any kind of crisis, there is the medical surge that happened first, and then the psychological effects happening secondary. And so we expected that as the pandemic went through its normal cycle, just like a tornado or anything else, that we would see a surge in the need for mental health support. And that's exactly what we've experienced. We have seen an increase, just like the rest of the country has, in addictions issues, depression, anxiety. At Aspire, we're seeing a lot of new folks reaching out to us, which is great, that have specific issues, the depression of being from COVID or having needs unmet. You know, people are having more employment issues and family issues, and even those folks that are lucky to be able to work from home and also are homeschooling, it's a lot of stress. And we believe at Aspire that reaching out for help is an act of courage. And so we're thrilled when people ask and reach out for help, and we want to be that support. And I'm hoping that you and I will also talk about, there's lots of things that folks can do to help manage the depression and anxiety that comes sometimes because it's the holiday season, and also because we are 7 months into this pandemic.
Well, let's talk about that, because I know that there is a real need for people to want to be, we're social creatures. We want to be with other people. And the directive that we're giving from the health department right now is to keep those holiday celebrations small. Let's not, invite your extended family. And that can kind of play, a different piece when it comes to mental health. It could only exacerbate the problem. So how do you balance that if you're someone who's finding yourself depressed or having some issues right now, and then being told that you have to stay home and away from family and loved ones?
Absolutely. It can be really difficult. It's also an opportunity to start really creative. We've all got our own family holiday traditions, and some of those we may need to set aside this year. But it also gives us an opportunity to sit down with our families and friends and neighbors and think about, what can we do differently? How can we manage this in a different way? What new traditions can we put into place? I have friends that usually travel out east for Thanksgiving, and they did not do that, but they did a Zoom family trivia night, and they had all their family from across the country, playing family trivia. And there are lots of creative things that we can do, new traditions with our children that we're living with inside of our containers, and activities that we can do. One of the best ways to manage depression and anxiety is to keep a schedule and to keep a routine. And even though you may not leaving the house, that you shower and get up, eat your meals at the same time, do all of those normal daily tasks, do your work, put on shoes and socks. Right. And
I remember you telling me this, Diana. I remember you telling me this back in April, and I'm like, I can do that. Right. But now 7 months into it, with the kids at home and working from home, it's a challenge to even do that some days.
It is really a challenge, and but it's also a great way to continue to maintain your mental health, is to make sure that while you're caring for all those souls in your home, that you're caring for yourself, and that you're taking the time to do all of those normal routines. That really helps combat.
What else can we do in the extra stress load of the holidays?
Right. So reaching out when you do feel like you've had too much isolation, make sure that you reach out and that we reach out to others. There's no better way to help yourself than to help someone else. So connecting to a loved one or a neighbor or a friend that you haven't seen, that you haven't heard from, you have no idea how that might help them and touch them, and that can be really positive, and then you've made another connection. So always remembering that helping others helps us as well.
What a nice idea right around the holidays anyway.
Absolutely.
Okay, so what if those things aren't enough? I really feel like I need some help. Who do I call?
Absolutely. Please call Aspire. We're here to help. We are your designated community mental health center in Hamilton County. We have an access line for new appointments, which is 317-574-1254. And if you are in real crisis, if you or your family member is in a real crisis situation, we do have a 24-hour crisis hotline that you can also reach out to, 317-574-1252. When you're calling our access line for a first-time appointment, you will talk with someone about getting connected to a therapist. We might be able to connect you right then. That first appointment is going to be a little over an hour. It's like going to a new doctor for the first time. There'll be some questions and some paperwork, and then you'll be connected to a licensed clinician that will go through an assessment and ask lots of questions, talk you through what your needs are, what you're feeling, and then begin to help you make a plan, what treatment, and then you would be then connected to additional appointments that you might need. The other thing, Tammy, that I really recommend for people is that they also take care of their physical health. Because our mind and our bodies are connected, which is why Aspire is an integrated health entity, and we want to take care of the whole person. And the way that you can really help manage your mental health is making sure you're connecting to your doctors. You can have virtual doctor's appointments. If you need to be seen by a doctor, you can see him or her in live, with precautions. Hospitals and doctors' offices are getting really good at this now, but this is not a time to not take care of your physical health, because that does affect your mental health.
Yeah, let's talk about that, because for those who don't know, Aspire does more than just help with mental health. You guys are federally qualified healthcare providers. So talk about some of the other services that you can provide that people probably may be in need of right now.
Right, absolutely. So we can do primary care. So if you don't have a primary care physician, a medical home, we can provide that service to you and your family. We can see children on all through the lifespan to have those medical needs met, the behavioral health care. We also now are a COVID testing site working with the Hamilton County Health Department. We have a testing site right on 146th Street in Noblesville. And we offer also housing and employment services. Our employment services have continued to support folks and help people find jobs all through COVID. We work with a lot of employers and different federal and state programs to make connections for folks looking for employment, or some folks are underemployed and they need help getting to that next level. And so we can provide that, as well as our housing. We have homelessness grants, working with folks to make sure that they can get into the right types of housing. So there's again, the whole person is what we want to serve, and the whole family.
I've seen these memes on Facebook and Twitter that say it's okay to not be okay. And I think maybe we all need to hear that a little bit right now. But beyond that, not only is it okay to not feel okay, there is help for you if you need it. So reach out. Diana Huddleston is the Director of Comprehensive Services with Aspire Indiana. Thank you for the good work you guys are doing. Keep it up and let us know if there's anything that we can do to help get more word out.
Thank you so much, Tammy. I really appreciate it.